Typically when we think about healthcare, we think of it as a local sector activity. It's direct provision by physicians and nurses and other medical staff face-to-face with people in the local economy. But in Portland, we also have a traded sector component where we have local employers here who are bringing dollars in from outside of the region. We need that traded sector activity to grow. Bigger traded sector healthcare done well would be good news in Portland.
OHSU participates in the traded sector economy in each of its mission. We bring students from not only around the state, but around the region, around the country, and even around the world. In research, we attract research dollars, again, from a very wide region, both nationally and now internationally. In patient care, while the majority of our patients certainly come from Oregon, more and more we are attracting patients from outside the state and outside the region. In each of those instances, large flows of dollars accompany that activity.
HealthSpark, for example, one of our subsidiaries, does business with 60 different health plans all around the nation. So that gives you an idea that there's a fair amount of money and wealth that's actually being brought into the Portland metropolitan region as a result.
A lot of attention lately on middle wage jobs. That part of the economy hasn't been growing as fast as other parts of the economy. Healthcare is different, and healthcare is different because you need humans to interact with technology, and you can't replace the human touch in healthcare. You need somebody to be able to interact with the patient, but also with the technology, and that creates the opportunity for middle wage jobs.
Overall, we see the job growth happening primarily outside of the walls of the hospital. And so we see it in physician clinics, we see it in home workers, and in the employment inside the walls of the hospital has been pretty flat to stable. So that's where the growth is. And we see that happening in the future. We're going to see more case workers in the community, more people working on one-on-one patient individual needs in the community to meet their needs, and continue to see how care can be provided out in community settings.
The Passport to Health program got started when the city of Portland approached us. They realized that 5% of their population were consuming 50% of their healthcare dollar. So they realized that they had to do something. We partnered with the city to collaborate on building a program that would provide intense, personalized services, supporting people really in their homes.
OHSU has a history over the past several years of adding many family wage, middle income and above jobs.
Kaiser Permanente has been a huge contributor to the local economy. By establishing this world-class medical center in Hillsborough, we added 1,000 living wage jobs to this community, which we take a lot of pride in.